The mass testing for COVID-19 is revealing the picture of the contagion in the country. However, questions are surrounding the tests that seem to vary from one testing center to another. Concerns have been raised on the accuracy of the test kits as the country grapples with the growing number of positive cases, as Charity Mwangi now reports.
First comes the test, then the fear and anxiety of results. You are either positive or negative. Then comes the overwhelming feeling on what are your options. Either you will be quarantined or resting comfortably on the confirmation of negative results. 2 domestic helpers in Nairobi had gone through the procedure, if only to keep the families they work for comfortable. The results that they got from Lancet Laboratories were shocking. The 2, who will remain anonymous, tested positive for COVID-19. They sought a second opinion. One went to the Nairobi hospital, while the other one opted for state-run KEMRI for another round of tests. In the time between receiving the first test results and the second results, obvious precaution had to be taken. The 2 were isolated with the families they work for, ordering for more tests to confirm their status. All the tests came back with a resounding negative result. It may be unclear which of the results were correct. But what is clear is the fact that some of the positive cases being reported by the Ministry of Health may in fact be subject to human error, as Health CAS Rashid Aman admits.
The testing protocols of laboratories, even with a standardized testing protocol, because it is humans who are involved in the process, there is can always be some level of error where tests may vary in terms of their results.
According to the founding partner at Lancet Laboratories, Dr. Ahmed Kalebi, the kits used at Lancet are superior and more sensitive than those being used by other laboratories. He claims that it is unlikely that the error was on their side. He says, and I quote, "Our tests are very specific. They test 3 genes, while Nairobi Hospital tests for 2 genes, the S gene and the E gene." Dr. Kalebi explains that one can get varying results depending on the kits used and how the sample is collected. The government says they are now addressing the errors.
So we have a protocol that we have developed for quality assurance, and I think in time as we put that in place, we shall be able to help some of these labs that might from time to time return conflicting tests to come up to standard so that those tests then become very reliable.
The admission by government leads many to question if all the patients in quarantine facilities are infected, and if those figures announced by the Ministry of Health are correct. Just how many false negatives or positives are out there? The conflicting readings in the case of the 2 domestic workers is a testament that you can wrongly be declared to be virus-free after being tested, but unwittingly pass it on, and the opposite is the truth. Charity Mwangi, NTV.